Streaming is on.
Yes, sir. The salary for the minimum nurses is ranges from 1,400 to 1,600 based on CCNL contract. Okay, based on the government will be fixing this one. Then afterwards, hospitals or whichever the structures whom you are going to work, based on their, they will be giving you certain how in India there is certain what they will call, sir, uh, certain benefits they will be giving by giving housing allowances. Okay, there will be giving housing allowances if hospital is in city center, the housing allowances will be more. And as like in India, if it is in a if it is in a district quarter or taluk quarter, there will be like certain gradation, same like here it will be there. And also there will be like they will be giving the hospital bonus and all. Hence there will be a difference between hospitals, old age homes, and also psychiatric nursing homes, sir.
Thank you, Himegara. Uh, there were these private hospitals. They have, do they uh, in India? Unfortunately, in the private hospitals, the salaries are less. I don't have experiences of nurses who have shared such experience. I just heard that from some of the nurses. They, in the European Union, the private nurses working in the private sector have been paid more. Is it true? In, I don't know. You are the first whom I can address this issue. Is it correct?
Yeah, sir. Yeah, sir. As I told you that here the public, how it works, public hospitals and private hospitals. Private hospitals are the clients are very rich peoples. Okay, because all the private hospitals who will be going there, there will be a clients will be rich. And if you want to satisfy your clients, means you have to get the best nurses among all of the nurses or best persons. You have to give the best service. Hence private hospitals, there will be well paid salary, sir.
Thank you. Before
Yes.
we end, are there any redressal cells? For example, somebody has a racial comment from the colleagues, or there's a conflict between the patient and nurses or within the colleagues. Are there any redressing cells in your country, in Italian, I mean,
Yeah,
hospital level or yes, state level or national
yeah,
level?
yeah, sir. Yeah, sir. I will answer for this. Okay, sir. In however, like especially in European countries, there will be a lack of racism and all. It will be less compared to other European countries, especially in Italy. Italians are very social people, and also they are very friendly peoples. Okay, the thing is like wherever you go, there will be like good persons and bad persons will be there, and based on how you will be there. Okay, you are very good to them, they are very good to you. And if you make any bad things, they will also reply in the bad things. And usually, especially in the professionalism, like we are the nurses and all the things, and with the colleagues, there will be no racism or anything. But the thing is, when you enter into the profession, like with your accent or with your language and all, there will be a like barrier. And usually we know, as you know, my English accent is different and your English is different, and also our North Indian English is different and South Indian English is different. When you hear this, when the South Indian goes to North India, or from North Indian guy come to South India, when they speak certain slangs and all, for that they will be just having the problems. Then afterwards, once you get used to that, they are very good people. And there is no racism that you are Indian, Pakistani, or any other thing. There will be no open racism will be not there. But usually they are very social and also very friendly nature people, and they like our Indian people. As you all know that our Indian Prime Minister has married with this Italian girl Sonia Gandhi. Hence, we have a very good reputation. And nowadays, after coming Modi here and all, there are a lot of strong relations is going on. So many businesses are growing very well between Italy and India. Before there was like a marine issue was there, like two soldiers we have been kept due to Kerala issue and all. That time there was a lot of sarcastic things were there. Now after coming Modi and all, there are after G20 meeting here there are a lot of improvements between Italy and India. There are a lot of good relationship is going on. Then they are now strengthening little bit more after here now Meloni is the president, and she is also from the right wing. Hence, there are good relation between India and Italy is going on, sir.
Thank you. That's if you have any, I request again, Himegoro, you take some your 5 to 10 minutes of time, and there is a one live in when you go. I will send you a link.
Yeah,
There
sir.
you can upload the links for various what the if somebody want to see the salary structure with themselves. If you could share the links with a larger community, that will be good. And this
Yeah,
is
sir. I
available
share you, sir.
always on the YouTube. Anyone can see, and anyone can take a time to understand how it is. If there are
Yeah,
any issues, they will come back to you, or they can consult wherever whomever they want, and free to do that.
yeah, sir. Sure, sir. I
Yeah.
will just share you the some of the websites, but most of all the websites it will be in Italian, but they have to convert into they have to translate into English language. They know that they have to take the screenshot or PDF format and they can translate to into that. That's not a problem, sir. I will share, sir.
Thanks a lot, Hemigoda. Jansi, over to you.
Yeah, sir. If any aspect before going to that Jansi, Santosh sir, if any aspect I didn't covered or anything to cover or anything we have been discussed and I have forgot to ask, forgot to explain, you just let me know. I can just spare another 10-15 minutes, sir.
Yeah, Himegoro, as of you have explained more uh, very in detail and in very in easy format. Thanks for it, and more than what we discussed, you came in your speech, in your narrations. It came out. Thanks for that. The only if it is possible, is it you take your time. I am not
Yeah, yeah, sir.
immediately a diagram on a paper. You can just make a before coming to India, what and all things to be done. When you come to India, between India and Italy, this transition time, what you are doing, the adaptation course, which is around, let me say, 4 months, 5 months, sometimes 6 months, how much time it takes, what are the things they should do. And once they register, we need not to worry about that because they are registered nurses. So if you could able to make a only in one sheet, I can send you a format of that to your email ID. If you
Okay.
could able to uh, do it, that will be easy. Always anyone can see in one eye blink and say, okay, it is here which I have to follow. That will be very nice of you.
Yeah, sir. Sure, sir. I will do that one. That's not a problem. It's like a schematic diagram. As usual, you are telling that every steps we will mention by seeing the diagram only. They can understand what all the procedures are required, or they can't able to miss the steps also. That
Yeah.
we can do, sir. That's not a problem.
Thanks a lot. Thanks a lot, Hemegada.
Yeah, it's my pleasure, sir. Thanks a lot to you.
Jansi, over to you.
Yeah, thank you, Santosh. Mr. Hemagowda, thank you so much for giving us the information on migration process of to the Italy. To and our nurses, I think definitely will be benefited with the information that was discussed today here. And definitely, as Sir told, if you it would be great if you could send the links to us so that the viewers can follow the link and get an access to the areas where they can get correct informations like the process of immigration. So first the step by step pattern, what is there. So in each step which is the area, or what link has to be followed. Suppose if they need to contact the consulate or the immigration wing, if there is any link which they could follow and they can get there. So those things, if we can add in that, it will be very great. And thank you so much for
Sure.
your precious time.
Okay. Thanks a lot. Thanks a lot, everyone. Thanks for you also, and I especially special thanks to Dr. Santosh sir, who has given the opportunity to meet you all. Thanks a lot, and thanks a lot, everyone.
Thank you, Hemegowda.
Thank you.